ovarian syndrome is the most common endocrine disorder affecting women, and it affects up to 10% of women. But if it's so common, why is it so difficult to get a diagnosis of PCOS? And why are there so many women walking around that still are undiagnosed? If you've walked this PCOS journey, then you may be familiar with this phenomenon. You may have experienced certain symptoms and perhaps you went to your doctor and ended up going back and forth for several months before you actually ended up with a diagnosis. The flip side of that coin is that some women get a diagnosis of PCOS even though they don't have polycystic ovarian syndrome. So what is going on with PCOS? Why is it so difficult to diagnose? And why are so many people undiagnosed and so many people misdiagnosed? That is what we're going to be talking about in this video. Hi, I'm Dr. Carmen. If you are new to me, I'm an integrative medical doctor and health coach, and I love talking about period problems. So if you want to learn more about your period and more about PCOS, then consider subscribing to this channel. And if you are not new to me, then thank you so much for coming back, and I'm so happy to have you joining me in this video. Part of the reason why PCOS is so difficult to diagnose is because it's not a specific disease. Rather, it is a syndrome, which basically means it's a group of symptoms that are bundled together and given the diagnosis of polycystic ovarian syndrome. Now, these symptoms are specific to ovulation. In other words, they're symptoms that will tell us that you're not ovulating, and also symptoms related to excess androgens or excess male type hormones. And so today we're going to be looking at two diagnostic criteria in particular, and then some of the tests that can be done to further clarify this diagnosis. So if you want to learn more about PCOS diagnosis, then keep watching. So we know that the main symptoms of polycystic ovarian syndrome are related to irregular periods or anovulation and elevated levels of androgens. So how will you know if you've ovulated? Because one of the symptoms of PCOS is anovulation or an absence of ovulation. Typically, the signs that you would experience if you are having anovulatory cycles is your period will be irregular, and sometimes you may even have prolonged bleeding when you are on your period. So typically, we would expect a new cycle to begin every 21 to 35 days. But people with polycystic ovarian syndrome will have cycle lengths longer than 35 days. In other words, you'll have more time in between your periods. And then when you start bleeding, you may bleed for many more days than would be expected. Typically, this is because of a lack of progesterone. You make progesterone when you ovulate, and so if you don't ovulate, then you actually won't be producing progesterone, which means that you may bleed for a prolonged period of time. So irregular cycles, long cycle lengths, and long bleeding times are all symptoms of anovulatory cycles. Another phenomenon that may happen when you have polycystic ovarian syndrome is you may have something called oligomenorrhea. In other words, you bleed very little for a very short period of time. And so this may seem paradoxical, but ultimately, if your period is very light and if you're bleeding for less than 2 days at a time, then this would also be considered irregular periods or oligomenorrhea, which is also a symptom of polycystic ovarian syndrome. Now, what are some of the symptoms associated with high androgens? Well, these include excessive hair growth. Now, a little bit of extra hair on the upper lip is considered normal. But if you have excess hair growth on your upper lip, on your cheeks, on your chin, on your chest, around the nipples, on the lower abdomen, and if you're noticing that this hair growth is becoming quite thick and coarse and you're having to start to do things to kind of manage this excess hair growth, then that is called hirsutism. And that's just a medical term for having excess hair growth in unwanted places. So that's one of the signs of high androgens. Another sign of having elevated androgens is adult acne. So typically this acne is in the distribution around the jawline, but it actually can affect the whole face, the chest, the upper arms, the back. And it can range from a bit of breakout here and there, some whiteheads, blackheads, all the way to cystic acne. So acne in adulthood is typically not considered normal and is a sign of potential elevated androgens. The third symptom of elevated androgens or male type hormones is hair loss. Yet another paradox in PCOS. On the one hand, you may have excess hair growth in unwanted areas, and on the other hand, you could actually be losing your hair, in particular at the top of your head. This is also known as androgenic alopecia. And so typically, if you are losing excess hair, when you're combing your hair, you're noticing that your hair is falling, or even perhaps if you notice that your hair is thinning in certain areas, this could also be a sign of having excess or high androgen levels. Now let's take a look at some of the criteria that we use to diagnose polycystic ovarian syndrome. You may have heard of the Rotterdam criteria. Now the Rotterdam criteria is commonly used to establish whether or not somebody could potentially have polycystic ovarian syndrome. Now we're going to be talking a little bit about why the Rotterdam criteria isn't an ideal criteria to use to diagnose polycystic ovarian syndrome, but it is commonly utilized, and so it is important to understand what it's all about in order to establish how your doctor would have come to your diagnosis of PCOS. Okay, so you can qualify for a diagnosis of PCOS using the Rotterdam criteria if you have 2 out of the 3 criteria. And the 3 criteria are anovulation or oligomenorrhea, which is, as we mentioned before, irregular menstrual cycles or very little bleeding or very long menstrual cycles. The second criteria is that you have features of high androgens. So this would include symptoms of excess androgens, as we described some of them before, excess hair growth, acne, and hair fall, and or an increased amount of androgens on your blood tests. So there is a way that we can determine whether you have high androgens by running some blood tests. The third criteria is that you have a polycystic appearance on your ovaries. Now, the word or the term polycystic ovarian syndrome is actually a misnomer because the cysts that are apparent on ultrasound when we're looking at the ovaries are actually not cysts really. They're actually immature follicles. So if we take a few steps back and we go back to biology 101, every time you have a menstrual cycle, what's happening is that your body is preparing an egg for fertilization. So what will happen is a few immature follicles in your ovary will begin to mature. And then eventually one of those follicles will mature more than the rest of the follicles in your ovary. And eventually will begin to suppress the maturation of the other follicles. And eventually that one mature follicle is going to burst through the surface of the ovary and travel through the fallopian tubes on the way to the uterus. Now, if it is not fertilized in the fallopian tubes, then it will be passed or shed together with the lining of the uterus in the period. Now, what's happening when you are not ovulating is that instead of one of those follicles maturing more than the others and suppressing maturation of the other follicles, what happens is that a group of that group of follicles that initially started to mature will continue to mature, and then eventually they'll stop maturing. And so when you look at the ovaries on an ultrasound, you'll see these multiple little sacs. Sometimes they're referred to as a string of pearls appearance. In other words, they look like these little beads that are in like an arrangement inside the ovary. And so they can look like cysts or appear like cysts, but they're actually immature follicles. But the thing about that is that you can actually see that appearance in a few different scenarios. So you may actually see that appearance for people, for example, who are taking hormonal birth control. Having multiple immature follicles in your ovary is quite common if you're taking hormonal birth control. So you can see that using the appearance of cysts on the ovaries or having multiple cysts on the ovaries doesn't necessarily mean that you have polycystic ovarian syndrome. Likewise, if you look at the Rotterdam criteria, you can have anovulation and high androgens without cysts on the ovaries and still be diagnosed with PCOS, which is actually fine. But the problem with the Rotterdam criteria comes in where you have irregular periods and cysts on the ovaries. Because if you have those two features without excess androgens, then do you really have polycystic ovarian syndrome? So that's the major question, and part of the reason why the Rotterdam criteria, while it is commonly used, is not the favored criteria when coming to a diagnosis of PCOS. Hey, if you're finding this video helpful, then please consider subscribing to this channel and hitting the notification bell so that you get notified every time I post a new video. And if you are looking for extra guidance or help on your PCOS healing journey, whether you've just been diagnosed and you're confused about where to start or what to do next, or whether you've been going at this for a while and you feel like you're trying a whole bunch of things and you're not getting any results, then I've put together an ebook and workbook called the PCOS Made Simple Ebook and Workbook Bundle. And this will walk you through the steps that you need to take in order to heal your PCOS symptoms naturally. You can check that out in the link in the description box below. So that brings us to the second criteria that could be used to diagnose polycystic ovarian syndrome. And this is called the Androgen Excess and PCOS Society criteria. It's a mouthful, but let me explain exactly what this criteria is all about. So again, we have three criteria, but using the Androgen Excess and PCOS Society criteria, you have to meet all three in order to be diagnosed with PCOS. The first criteria is ovarian dysfunction or irregular periods, and or the appearance of cysts on the ovaries, or that classic polycystic appearance on your ovaries. The second criteria is if you have clinical or biochemical evidence of high androgens. In other words, if you have symptoms of high androgens like we discussed, and or if you have elevated androgens on your blood tests. And the third criteria is if all other explanations for high androgens have been excluded. In other words, there's no alternative diagnosis that would explain why your androgens are elevated. And so you can see that the AE-PCOS diagnostic criteria includes both abnormal periods and high androgens together in order to make the diagnosis of PCOS, compared to the Rotterdam criteria, in which you may or may not have androgen excess and still meet the criteria for PCOS. So you can see why the AE-PCOS guidelines or criteria are more favored compared to the Rotterdam criteria. So we've mentioned ultrasound as one of the tests that can be done to further clarify this diagnosis of PCOS. And typically your doctor will be looking for that cyst-like appearance on your ovaries. But as we said earlier, you don't necessarily need to have this feature to be diagnosed with polycystic ovarian syndrome. But an important group of blood tests that is vitally important to run if we are going to further clarify this diagnosis of PCOS is blood tests looking at your androgen levels. Now, you need androgens, or your male type hormones. So you need them to help to maintain your mood, your libido, and they can even help to protect your bones. But having excess or high levels of androgens is where the problem comes in. And so when we do blood tests to further clarify the diagnosis of PCOS, there are a few androgens in particular that we need to be paying attention to. Okay, so what are some of the androgens that need to be tested? Well, these include your total testosterone, androstenedione, and DHEAS. Now, if your doctor is only testing your total testosterone and not your free testosterone, which is actually the best indication of excess androgens, then it is advised that they do a sex hormone binding globulin as well. And typically, the sex hormone binding globulin will be low in polycystic ovarian syndrome. Now, of course, there are a host of other blood tests that can be done in order to further crystallize the diagnosis of PCOS and, importantly, to tell us more about your PCOS type. You can find a comprehensive list of all these blood tests in a table in the PCOS Made Simple Ebook and Workbook Combo. You can find a link to that in the description below. And if you want me to dive into some of these blood tests in a bit more detail, then feel free to let me know in the comment section. And if you have any questions about PCOS, I'd be happy to answer them in upcoming videos. Leave them for me in the comment section below, and don't forget to subscribe to this channel and hit the notification bell so that you can get notified every time I post a new video. If you've made it this far, thank you so much for watching, and leave me a heart to share some love in the comment section below. And go ahead and watch this video next on how to lose weight with PCOS. I'll see you in the next video.